Good morning or good afternoon, depending on where from are you listening us. This is EUROSTUDENT Talks, and today we will be talking about the impact of COVID-19, students' well-being and their approaches to learning. And we will be doing that in context of Danish experience. For that, I'm absolutely happy to welcome here Amanda Weber. Amanda is a master in public health from University of Copenhagen. Since graduation, she has been working in the Danish Agency for Higher Education and Science. Amanda is an analyst and works mainly in the area of student well-being and students' teaching and learning environment. Today, Amanda will introduce us her research findings from a paper which was co-authored by her colleague from the Danish Agency for Higher Education and Science, David Vestergaard Eriksen. We are very excited already to hear your presentation, Amanda, so the floor is yours.
Thank you. Hello, everyone, and thank you, Malene, for giving me the opportunity to share the findings from me and my colleague David's newly published article. And if you haven't seen it yet, you can find it either on the website or in the email you might have received already from EUROSTUDENT. Otherwise, there's also a link in the last slide where you can find the article. I hope you have time to take a look at it. But yes, I will tell you a little about our study, where we have looked into how COVID-19 has affected students' well-being and students' approaches to learning in Denmark. And first, I will give you a short introduction into the outbreak of COVID-19 and its consequences in Denmark. So on the 13th of March, all higher education institutions in Denmark closed down due to a rapid increase of the increase in the spread of the new coronavirus. The Danish government, they introduced some national restrictions, and also lectures, classes, and exams were changed into online teaching. Some of the restrictions which were introduced by the government were physical distance, social isolation, also a ban of visiting more vulnerable people, and a ban of assemblies more than 10 people. During COVID-19, worries about becoming ill or knowing someone seriously becoming ill and not being able to see family and friends were some of the factors which influenced students and young people's lives. Also, the experience of cancellation of one's study activities, the cancellations of internships, and not being able to go abroad and studying were some of the challenges that students faced, which had an impact on their well-being. But however, the transition to online teaching might not affect all students in the same way. So hereby, our overall purpose was to investigate how COVID-19 restrictions affect students' well-being and approaches to learning, and also to investigate what role well-being plays in the relationship between COVID-19 impact and students' approaches to learning. And yes, I will give you a brief introduction to the background and the reason why we chose students' approaches to learning as the outcome variable. Learning is a really complex phenomenon, and learning can be measured in many different ways, and it can also be interpreted differently. So we decided to look into students' learning approaches because we have found that it's actually associated with some different learning outcomes. We have seen there is an association to the academic achievement, students' academic performance, and also students' GPA. Furthermore, it is also well documented in the literature that students' learning environment affects students' approaches to learning, and also the opposite way around. And what I mean by students' teaching learning environment is the interaction with peers, social events, students' interactions with their lecturers, and also feedback. We also know from a Danish study that students' well-being are correlated with students' approaches to learning and students' teaching learning environment. So that's a little about the background. And students' approach to learning is a theoretical concept which refers to students' intention regarding their studying and learning, and it can be divided into two different approaches. The first approach is a student's deep approach to learning, which means that they show interest, they try to understand learning in a broader perspective, and they are able to relate and compare what they have learned to other research. In contrast, we have students' surface approach. That's the question you see down here. Where students to a higher extent focus on the rote learning and they more study to pass the exam. They also try to memorize what they have learned and use a more reproducing approach. They try to see information as unrelated bits and are not able to analyze and not really understand learning in a more broader perspective. So in some way, it's like the contrast to the deep approach. And the deep approach have been found to be associated with a high interest and motivation in learning, while it's also found to be related to an overall positive experience of the learning environment. While on the opposite side, then we have the surface approach, which are more found to be associated with the low motivation and a more negative perception of one's teaching and learning environment. Yes, and now to our hypotheses. Because based on these assumptions that I just mentioned, we have developed 3 different hypotheses. And if we have the COVID-19 impact down here, our first hypothesis is that COVID-19 that COVID-19 has affected students' well-being. And then we have the second hypothesis where we think that COVID-19 also have had an impact on students' approaches to learning. And then we assume that that students with a high impact from COVID restrictions are less prone to exert a deep approach to learning, while they are more prone to exert they're more prone to exert a surface approach to learning. And then we have the last hypothesis, which is that the well-being, which we have here, mediates the relationship between students' perceived impact from COVID-19 and students' approaches to learning. And what we mean by mediates is that well-being can explain some of the effect from the COVID-19 on students' approaches to learning. So that's the 3 hypotheses that we have looked into. And of course, we cannot say anything about the causal inference. And here you also have the 3 hypotheses. Yes. And now to our method. We used cross-sectional data from the Danish National Survey, the Danish Student Survey, which we conducted in fall 2020. Nearly all students in higher education in Denmark were invited to respond to the electronic questionnaire. And as you see, it was about 95,000 students who participated, so actually a quite large sample, and we had a response rate of 37%. We used multiple linear regression analysis, and we adjusted for different student characteristics, which we have found to be related to our COVID variable, but also to our outcome variables, students' deep approach and the surface approach to learning. And then we also applied fixed effects at a certain faculty level, using the combination of department and academic field of study to omit any influence from local level variations. Yes. To measure the COVID impact, we developed a COVID scale based on the 4 questions that you can see down here regarding students' perceived impact from COVID restrictions. And we divided the scale into 3 different categories based on student score. Students with a score level lower than the 25 percentile were classified as low impactors, while students with the score higher than 75 percentile were classified as high impact from COVID-19, and the rest were categorized as moderate impactors. Well-being, that's the questions you see up here, was measured by W5, which is a validated scale for well-being, and it ranges from 0 to 100, where 0 is really, really low well-being and 100 is a really good well-being. And it's based on the 5 questions, which you can see here. And the questions measure like positive experiences during the last 2 weeks. Yes. And now to the results. As you see here, we have the distribution of the COVID scale. And as you can see, the scale almost follows like a normal distribution, which actually indicate that students have felt a different impact from COVID-19. If you see on the right side of the scale, then we have all the students with a high score, indicating that they felt a high impact from COVID-19. On the left side of the scale, we have, in contrast, the students who did not really feel a high impact or maybe no impact from COVID-19. They actually had a low score on the COVID scale. And we found that around 30% of the students actually felt almost no impact or a really small impact from COVID-19, while around 1 out of 4 students felt a really high impact from COVID-19. Yes, and now to our hypotheses. To answer the first hypothesis and how COVID-19 has affected student well-being, we used multiple linear regression analysis, which you can see the outcome from here. We had the low COVID-19 impact as the reference group, and then you can see that students highly affected by COVID-19 had a lower score of well-being compared to students with a moderate and a low impact from COVID-19. We can also see on the graph over here that this on the y-axis is the W5 score, and then we have students' impact on the x-axis. And here we see that the total mean score on the W5 scale is around 62 among students who felt a low impact, while it's more like around, one second, I think I wrote it down. No, it's not here. But it's more like around 50, 47, I think it is, for the students who felt a high impact. So we actually see a really large difference between students who felt a high impact and students with a low impact on the W5 scale. Yes, and as you can see, the results are highly significant. All right. When looking at our next hypothesis and how COVID-19 affected students' deep approach to learning, we also used the multiple linear regression analysis and developed 2 different models. In the first model, we only applied, wait, I need to find the mouse. In the first model, we only applied students' impact from COVID restrictions, while in the second model, we also applied well-being or added well-being. And of course, we also adjusted for different control variables in model 1 and model 2. But what we see here is if we look in the first model, then we see that both high COVID-19 impact and moderate COVID-19 impact are both significantly associated with the deep approach to learning. But when we adjust, or when we add the WHO5 score and well-being to the model, then the coefficient drop remarkable, and the high COVID-19 impact is not significant anymore. So we actually see that well-being explains some of the effect we saw before in model 1. And that's actually really interesting, because then we can see that it might actually mediate the relationship between students' impact from COVID-19 and their deep approach to learning. Yes. Oh yeah, I forgot to say that actually we have a really large sample. So we also ran this regression on a subsample, and then we found no associations at all between students who felt or students' impact from COVID-19 and the students' deep approach to learning. All right. Then to our last hypothesis. Oh no, sorry, it was that was the surface approach to learning. When looking at students' surface approach to learning, we found a more clear association to COVID-19 restrictions compared to students' deep approach to learning. In model 1, we have a surface approach, and again, it's only with the COVID-19 variables. And then in model 2, we also added the well-being score. But what we see here is that COVID restrictions were significantly associated with student surface approach to learning. If you look at the coefficients, they are significant. And the more impacted the student felt from COVID-19, the higher the score was on the surface approach scale. And maybe it's important to say that we measured deep approach to learning and surface approach to learning on the same scale. So we actually just see there's a larger difference, on the surface scale. And what we see in model 2 is that the coefficient still drops a little, but we still see an effect. So from the table before, where we looked at the deep approach to learning, we can still conclude that there is actually an association between students' impact from COVID-19 and their surface approach to learning. However, this effect size is smaller than the model without the well-being. But when we ran this regression on a subsample, we still found a significant association between COVID restrictions and student surface approach to learning. So we can actually conclude that there is a relation between these two variables. Yes. And then we looked at what role does well-being play when graphing it. And if you see here, we have the mean score, and we asked into student surface approach to learning and deep approach to learning on the same scale. So hereby we can put them into the same graph. And what we see here is that the relationship between COVID impact and students' deep approach to learning, that's the black line you see up here, it gets weaker when we control for well-being. And you can look at then we have the full line and then the dotted line under here, and the full line is not adjusted for well-being, while the dotted is adjusting for well-being. And when we adjust it for well-being, you can see that the line is almost horizontal, which means that there are no difference across the 3 different COVID groups. And if we look at the surface approach, we still see, we also see here that the association gets a little weaker. But if we look at the orange reddish line, where we did not adjust for well-being, we see there is a difference between the students with a low impact and the students with a high impact. And this actually still, we can actually still see this differences when we adjust for well-being. So this means that well-being actually mediates the relationship between students' COVID impact and students' approaches to learning, where we have like a full mediation up here when we look at the deep approach to learning, but more like a partly mediation when we look at the surface approach to learning. Yeah. And then to our conclusion. We found that students overall have been affected to varied degrees, like if we look back and the normal distribution at the COVID scale, we saw that students were affected differently, and then we had like different groups to compare. And then we also found that being highly affected by COVID restrictions were associated with a lower level of well-being and a higher tendency to adopt a surface approach to learning. We also found that a deep approach to learning only showed a very weak association to COVID restrictions, or almost disappeared when we adjusted for well-being. And then we found in the end that well-being mediated the relationship between impact from COVID restrictions and students' surface approach to learning. And for deep approach to learning, the link to COVID restriction was no longer present when we adjusted for the students' well-being. All right, and then I have in the end the overall take-home message and maybe some recommendations. Not all students have suffered during the COVID pandemic. Some actually found the flexibility really durable, and enjoyed that they have more time to focus and dig deeper at home instead of using more time for the social activities and so on. So we saw in our results that almost 1 out of 3 students did not really feel a high impact from COVID-19. Online teaching does not only have consequences, instead we should learn from the benefits, what actually works from online learning, and who benefit the most. We should maybe look a little more into what can we actually learn from COVID-19 and the new online learning standards, instead of focusing what did not learn. So I really hope that that we can have that in mind when we try to structure and develop new higher education initiatives. Furthermore, higher education should rethink in new and more innovative teaching forms that can give students an opportunity to stay like connected with peers, to still be social also in more online learning environments. And students' well-being should be taken into account when we improve students' approaches to learning, and it should in general be like a part of our new initiatives, because we know now both from this finding but also from other articles that there is a really strong connection and strong link between well-being and students' learning. Furthermore, interventions should not be broad and holistic, but instead they should be targeted, so they need the meat of different groups. And I think here that some students actually need social activities and enjoy being around people all the time. Maybe others find it better to have like room and safe. Maybe some actually find it better to have a larger flexibility. Maybe they live far away from their higher education institution, so they can actually benefit more from online learning and what we have learned from here. And yes, I think that was it. I hope I not got you too confused with all the variable expressions, but I also have some information. If you would like to contact me, then I have my email, and otherwise you can find the article on the link. Yes.
Thank you, Amanda. I also added the link of the paper to the chat as well. For some people it's double, but as some joined us later, I just re-added it once again, so they can already open it from the link in the chat if they want to. Anyways, thanks a lot for your nice presentation. I will open the floor for the comments and questions. So anybody, you can ask your question in the chat or just raise hand and I will give the word to you. All comments and questions are very welcome.
And I will try to answer it.
Yes, Aune, well raised hand, please, Aune.
Hello, thank you so much for the presentation. I was a little late, so I'm not sure, but about the conclusions you made. Yeah, I'm Aune from University of Tartu, Estonia, and it's very relevant to understand the decision making and the interventions and the consequences. And the conclusion you made that the interventions should be student specific or more sort of consider the impact.
Yeah. Yeah.
And big problem, of course, during the crisis, and I'm sure you can share, or at least, I mean, I don't know, but the question is, do you share or what is the outcome? What is the solution? Because during the crisis, the biggest problem for me as a vice rector to make decisions was that you see that the student groups are different, that the different decisions and more flexibility is needed, and you want to delegate the final decision making to the specific teacher in the specific classroom. But during the crisis, everybody is expecting sort of easy and simple and quick and sort of top-down solutions. So they are sort of waiting that somebody knows the answer. And that's the big sort of problem in this situation. And I don't see the solution to that. You see as a decision maker that not everybody is similar. And probably it's just a comment. There is no good solution for that. But thank you so much for this, bringing it out.
Thank you. Well, if I should comment a little, then I think it's normally it's really easy to make like one broad holistic intervention which might cover all. But I think especially what this article shows that we have different student groups who also has different needs, and it's good to get a better understanding of what needs they have. And I think what we can learn from COVID and the new online learning standards would be who will actually benefit and who will not. And then we can take that into account when we decide if the teaching and the learning should be online. Maybe it should be both online and class-based, but maybe think in new forms where we in some way can cover more different student groups. I've also worked on a project with students with impairments, and then we see that they actually have some barriers. Maybe they are in a wheelchair and they can't really get around in the institution or in the classroom. And maybe they could actually benefit from having some classes at home and stay online, but still have the opportunity to be social and stay connected with peers. So I think what my message is that we should try to think more inclusive, but still also in more flexible ways. But of course, we have some frames that we need to be, to take into account as well.
Thank you for the comment and for the answer. Any other questions or ideas you would like to share? Until you are waiting, you just mentioned students with impairments.
Yes.
Okay. I saw Helga's hand, but I will ask my question first and then I will give the word to Helga. You mentioned students with impairments, and I was also thinking that have you looked into the data also focusing on different student groups, subgroups of students, I mean, like students with impairments, students who are parents, for example, or not in this research? Maybe you did it yourself, you didn't mention it, you mentioned the whole sample, but I was just wondering. And if yes, what do the results show us?
Well, I have not myself looked into it, not specifically compared to the COVID context, but well, I have looked into different student groups. But what I have learned from others and heard from others is specifically students with impairment, that they have been fighting for a really long time for the rights actually to have some online teaching, online learning possibilities. And it never really happened. But then suddenly when COVID was here, then everything was possible. So I think like some student groups might actually fight a lot for some different rights. And well, when we are in a pandemic, then we have to change rapidly, and maybe something which were not possible before can actually become possible. And that's where I think we should have that in mind, and try to keep on the good work if it works for some student groups. If it comes to other groups, then I heard a presentation in Malta about students part-time or full-time. And then we saw that especially students who study part-time, they were not affected in the same way as students who studied full-time during COVID-19. And I think it could be interesting to look a little more into what actually characterized this part-time group, because I think some of them might have kids. And if you have kids, I think there is a larger flexibility. I know that from my colleagues as well, that some might also have felt a larger pressure due to all the kindergarten, which also were closed down in some periods. But now when kindergartens are open and we are working from home to some degree, then there is just a larger flexibility. And what I know is that in Denmark, we actually have a larger what do you call it? We are able to work from home now, and we're able to work more from home compared to before COVID. But what we see at the higher education institution is that they kind of got back to where they came from before COVID. And I'm actually also a little curious about how this situation might be in other European countries. If you have actually, maybe implemented new learning forms after COVID, or if everything just got back to what it was before. But my feeling is that we kind of got back to where we were before COVID. Of course, some small things have changed, but yeah.
Yeah, thank you. But Helga, then you had a comment or a question.
Yes, thank you very much. You already answered part of my question. That would have been, you've done your study or survey in the fall of 2020.
Yes.
And whether or not you did a follow-up survey and what the situation was like. You had lockdown in the spring of 2020.
Yes.
And you already said everything in higher education is sort of back to normal, or has the higher education sector discussed the lessons learned and stayed in online mode for special formats or for different groups? What's the situation? In Austria, I think we have a mixed picture, but there are more competent people here in this audience who could, who have more insight in that than me. So, if you could, tell us more about the situation.
I can try to elaborate a little. Well, we have not really made any analysis about how it has changed from during COVID to after COVID. I think like normally when we do different analysis, we have the COVID-19 as a factor which we have in mind, because it might have impacted some of the learning factors we look at, or maybe some of the well-being measures. but we have not made like a specific analysis about the changes. And actually right now I spoke to some of my colleagues and I asked them, do you know about the situation out there in the higher education institutions? Are they more flexible now? Do they have more online teaching? Well, they said that what they feel is that they kind of got back to what they came from, because they knew that students were struggling during COVID. They really wanted some more social activities. They wanted to see peers again and interact with the lectures, and they also they also felt a lots of feedback. So I think what they decided to do was like go back to where we came from, so we can kind of build up again. And what I hope is that we can still continue working on what actually works from the online learning, especially because we actually managed to implement it in our workplaces. So. But when it comes to the higher education institutions, I'm not quite sure what exactly they have changed since COVID. But it would be nice to look more into it and have a deeper insight. So maybe I can get back to you, Helga, if I get a better understanding of it. Thank you.
But we have here many people from different countries. So as Amanda has mentioned several times, that at least in Denmark, higher education institutions are quite back where we came from before COVID. Maybe someone can comment, how is the situation in other places? Just share your experiences or your impressions. How is it going in your country? If you know, have higher education institutions already changed something in their approaches to teaching, and are they more like online and less in classroom, or it's basically the same as it was before the pandemic?
Marlene, sorry, you are talking about the current situation?
Yes, like
in
after
higher
COVID.
education.
Yeah, after COVID, like is there something different when we think back to the period before COVID? Are higher education institutions now more online than they were before? Are they more flexible, or you can't see any difference anymore?
Like in many, excuse me if I speak, okay, I can speak, right?
Yeah, you can speak, we can hear very well.
Okay, during the COVID period, the vast majority of courses were offered online. I'm talking about 95%. Now this is not the case anymore, but I get the feeling that since we, let's say, passed the online conversion test so well with flying colors, we have developed self-confidence in online teaching. This is what we gained in our system. I mean, and it is now a part of the teaching and learning procedure. Of course, not in this percentage, because there is no need anymore. But it has been included in the higher education landscape, and it makes an integral part of it. This is what I think the impact is. Of course, everything has come back to normal, right? But I guess that's the situation in other countries as well.
Mm-hmm. So in that sense, it's back to normal, but this digital side is part of new normality in that sense. That
yes, I have the feeling that there was a kind of prejudice sometime. I mean, before the COVID, but nowadays we have the experience. We did it well. There were no major problems regarding the quality of education and teaching offered. And we have new legislation concerning higher education, but that's not the point today. And I see that in this new legislation, online teaching is a part, and in some cases an equal part.
Thank you, Yannis. Any other comments or reflections? If not, actually, I wanted to ask another question from Amanda, that are there any limitations of the study? Like, was it somehow more difficult to reach the students and collect the data during the pandemic, or maybe it doesn't affect the survey? And maybe also you can elaborate a bit on your research ideas for the future. Are there like any next steps or something you would like to look into, or rather like leaving this COVID topic behind?
Well, I will start with going back actually to the slide where you can see the COVID questions, because maybe it makes more sense then. All right, you can see the COVID questions here. When we collected the survey, it was in the fall 2020. But as you see here, we actually asked some students about the lockdown in the spring. So that means that we only included students who were able to answer the questions from the spring. And what I mean by that is that they had to be enrolled in higher education during spring before they were actually able to answer the question. So we had a large part of the students who were not enrolled in the spring because they were first-year students, and they were not able to answer the question. So they were kind of not included in this COVID scale. And we have found that in other research, we have an example from the Danish Evaluation Institute, where they published that especially students in the first year felt a really high impact from COVID, and they had a bad well-being and were struggling with learning loss and so on. And we did not include that group in our article or in our study. So I think one of the limitations might be that not including the first-year students, because they had to be enrolled in the spring, was that our results might have a little underreported maybe. So we actually found a really large group who did not really feel a high impact, but maybe the students who actually felt a high impact were not included here. So the group might have been even larger than it was in our case. So I think we had about 95,000 students who participated in the survey, and then we had about 60,000 we were able to estimate the COVID scale for. Yes.
Yeah, I see. But about your ideas for future research, is there something that you're still interested in regarding this topic and impact of COVID, or moving towards new ideas and new topics?
Well, I think for many, COVID-19 is last news, right? It's not really something that we talk so much about anymore, but I still think we can learn a lot from it, and we can learn a lot from the what have changed from before COVID to after COVID. And also when we do like different analysis, it's important to have COVID in mind and think about how it actually might have changed like the different student factors or study factors. And when it comes to what I would like to look more into, it would be more it could be nice to have a deeper insight into what subgroups might have had a different impact. Also because I think if the online teaching is becoming more what do you say, more useful, or it's gonna be
More common?
Yeah, more common. Sorry, I forgot the word. If it's gonna be more common, then it's nice to know who will actually benefit from the online teaching and who will not, and how should we actually implement it so it's going to be useful in our higher education system. And I also think it's important just to know that students are different, like in general. So if you want to make different interventions which should have a positive impact on students, approaches to learning, but also the learning environment, then we should know what actually differs between these different student groups and what they benefit for and what they do not benefit for. So I think like more a deeper insight into also part-time students could be really relevant, especially because in Denmark we have a focus and and a reform coming up according to the masters, and we would like to make people educate themselves throughout the whole life. And then it's interesting to see, if you're a part-time student, how do you actually differ from being a full-time student? And maybe also if you're part-time, do you have more online teaching? What kind of students actually decide to take courses which are online, and what kind of students take courses which are full-time and class-based? And we have like different patterns that could be interested to look into. So not like a specific one, but just getting a better understanding of different student groups. That's what I would find important.
Indeed, very interesting. Any other final questions or comments before we wrap it up? It's either ask and comment now or, but if not, I will say big thanks to Amanda. It was a very nice presentation. And thanks to all our listeners as well. I think it was very nice ending for this season of EUROSTUDENT Talks. We will have a summer break for next 2 months. So it means that we'll see you all again in September with new topics and new presentations. And until that, of course, meanwhile, you can, if you have missed any of previous EUROSTUDENT Talks webinars, you can rewatch them. You can find them at EUROSTUDENT webpage under the events subsection. They're all there. And of course, if you want to stay tuned about our upcoming events, then please follow us on Twitter, or you can also join the EUROSTUDENT Talks mailing list at EUROSTUDENT webpage. So thank you all, and have a nice summer. Have a nice day today, and we'll see you again when September starts.
Bye-bye. Have fun.
Thank you. Thank you for listening.